Local programming on KRWG made possible in part by viewers like you. Thank you.
Welcome to Fronteras, a changing America. I'm Edmundo Resendez. The Southern New Mexico Diabetes Outreach, or SNMDO, was formed in 1998 by local health professionals and other citizens who are dedicated to help prevent and manage diabetes. Our guest today is Trinidad Jasso, Jr., or TJ, who is a registered nurse and diabetes educator with SNMDO. TJ, welcome to Fronteras, a changing America.
Thank you for having me here.
You know, let's just get down to some numbers about diabetes.
Mm-hmm.
According to medicalnewstoday.com, 29.1 million U.S. children and adults, which represents 9.3% of the population, have diabetes. This is a rise from 25.8 million in 2011. Let's bring it closer to home and look at what do the numbers look like in New Mexico.
In New Mexico, actually, we have a big population because we have the Native Americans, and then in the northern New Mexico, and then southern New Mexico, we have a lot of Latinos. And so when you're looking at the Latinos in this area, of course, in Doña Ana County, they say about 36,000 patients we have that are diabetic. Then there's another 3% of that are running around that have all the symptoms of diabetes, but they don't know they have diabetes. But from that percentage, you're looking at about maybe, I think it was, we were looking at that, I think it's about 18,000 that are running around that are actually are diabetics.
That's Latinos. A pretty high number considering
Yes.
we are at what, 160,000
right.
in Las Cruces
In
alone?
Las Cruces, yes.
And how are they being treated? Are they being treated?
Well, some are being treated because they go to La Clínica Familia or Ben Archer. Of course, a lot of them are indigent patients. Some of them don't have insurance. And so those patients are the ones that are coming in with really severe complications due to diabetes. And of course, now with health reform in place, of course, we're hoping that we see a decrease of that and that they are seeking medical care through the clinicas and through their physicians, that now they will seek care. And of course, their financial status also has a big play with that because of the medications, the cost of the medications.
Is there a breakdown that you have as far as ethnicities in, southern New Mexico or even just New Mexico? What percentage, has the disease? And, you brought up something, poverty, what role does poverty play in the disease?
Poverty does play a big role because, again, here in Doña Ana County, we do have a lot of indigent patients, a lot of non-paying patients that does affect them also in seeking medical care. So a lot of times when they finally come in to seek medical care, they've already had really severe complications. And especially with the Latinos, we see that a lot. Because again, at the same time, some of them are not actually here legally, so illegally they're afraid to seek medical care at the same time.
How difficult is it to reach these Latinos, to educate them if they are not here legally and might be afraid of anybody that's coming to their house with a badge? Right.
You know what? A few years ago, we were involved, actually the other diabetes educator I work with Nuestra Vida program, and that was at Doña Ana Community Center and also at Vado. And they targeted the Latino community, and everything was done in Spanish, and it really attracted those people. And Maria did a fantastic job working with them, educating them on diabetes, what it is, and how they needed to communicate with their physicians and why it was important for them to seek medical care, either the Clínica Familia or Ben Archer, to seek those cares if they didn't qualify to go see their regular physician.
There are two types of diabetes. What are they?
There's type 1, which means the pancreas is not producing any insulin. Those actually, it doesn't matter what ethnic group you are, all of a sudden a virus hits the pancreas, it's not producing anymore. You see that, that's what they call juvenile diabetes, but it's type 1. And then type 2 is the one that you see is adult onset, usually above 30, age 30. But more and more studies we're seeing also in young kids or overweight kids. And so type 2, you can control it with diet, exercise, or medications. They can control it with that, and that's where the education comes in.
As far as, looking at education, how SNMDO works out in the community to educate at different health fairs. What kind of events are you involved in to help spread the word?
Actually, with those health fairs, actually they offer free blood glucose testing. They give them information about diabetes, what are the signs and symptoms of diabetes, and then also if they identify that there's a patient has a blood sugar that they check and it's way out of, let's say, over 200, then they recommend that they seek medical care, and they give them information and stress on them that they need to go seek medical care. Now, if it's in the 500s, immediately they recommend that they go to the emergency room because that's too high, and they need insulin to be able to bring it down.
As you're out there at these events, and somebody that might come in and get tested, how often and how surprising is it when somebody finds out they have diabetes, didn't realize they have it, and how shocked are they to realize that they have something that's really life-changing?
You know what? They are in shock. They can't believe it, that they have their blood sugar so high, because they can't really understand or grasp diabetes. Immediately a lot of them will say, well, I don't need candies, I don't need cookies, but then we start saying, well, a lot of the culture foods that we eat, the beans, the potatoes, the tortillas, those kind of things, the fruit, they don't realize that those are also turning to sugar, those starches. And so they go, well, I thought they were good. I eat the oatmeal, the avenas in this. And I say, well, yeah, that's still a carbohydrate. And well, I like to drink milk. Well, milk turns into sugar too. And then they like their juices, los jugos. And you're going, well, all that is sugars also. And they realize, wow, well, I didn't know that all these food turn into sugar. So they were also just thinking that it was just the candies, those kind of things.
Isn't that kind of a myth that you look at to say, well, if I don't eat candy, I'm fine. If I don't put too much sugar in my coffee, I'm fine. And then they realize, what are some other myths?
Well, another myth is, I remember as a kid, my mama says, don't eat too many candies because your blood's going to turn to sugar. Those kind of things. And we're going, oh, okay, well, we didn't eat candy, a lot of candy, because we were afraid our blood was going to turn real sweet, those kind of things. And then a lot of times, because of the culture, and they're not educated, they think, well, the doctor gave me these pills for diabetes, and it's like antibiotic. I just took it until it finished. And they think, okay, I'm cured from diabetes.
And there is no cure.
No. Once you have diabetes, it's a chronic disease. It doesn't go away. So that's educating is so important, educating about how to take care of it, control it before it controls you. So they're teaching them about the diet, the importance of watching their diet, exercise, and of course taking their medication if they're on a medication regimen, and understanding how the medications are going to work. Because sometimes patients would tell me, we'd go see them, and they say, yeah, the doctor put me on this medication, but it made me sick, it made me shaky, it made me this. And then I go, well, were you eating with this medication? Oh, no, well, I don't eat breakfast and all this. And you're going, well, guess what? This medication is going to look for those carbohydrates. You still need sugar in your body, because if you don't, this medication is going to deplete any sugar you have in there. And yeah, you're going to feel shaky and sweaty and feel dizzy, like you want to pass out. So a lot of times they're not educated on the side effects of the drug. And so they stop it, Or sometimes they say, yeah, I was checking my sugar and yeah, it was fine, so I just stopped taking it. Well, it's because the medication was doing what it's supposed to be doing, but they didn't understand that it's not like an antibiotic. You have to continue taking it. It's, and so they think it's just a one-time medication and that's it,
As, I want to continue with the myth issue because, my mother has diabetes, and one of the things that happens with my mother, and it's a cultural thing, is there's always a cure out there somewhere. I remember when she's still going through nopales, the cactus
right.
diet, where she, grinds it up and, she eats it.
Mm-hmm.
How challenging is it for doctors and for people in the field, that are in the field, to work with patients and to let them know, you need to be careful and not mix that product with your medication?
Mm-hmm. And you know what, because we do I would have a lot of patients that come in and say, well, I had a friend or una tía, the uncle that told me about some licuado de nopalito in Juarez, to go to Juarez and they make a licuado, and my diabetes went away, and I say, well, I don't really think it did, but, and a lot of times what we have to do is we just tell them, you know what, go and try it, and then check your sugar and see how that works, And so we try and work also with the cultural thing, because if you tell them, oh, no, it's not that, it's going to, I'll say, you know what, go try it and see how it affects you. Take it, and then in 2 hours, check your sugar and see what the results of your blood sugar were. Mm-hmm. And so then later on they come back, yeah, you were right, it didn't really work, But how come it worked with my uncle? I said, I don't know. Those kind of things.
And did it really work with your uncle? I mean,
exactly.
That's the thing, is that, if they're not getting medically checked,
right.
The people that are selling a product to them are in the business of selling them that product,
right?
Which means they'll say anything to
sell it, right? Yeah. Exactly.
We talked earlier about there being 2 types of diabetes, but in a way, there's actually 3 types, which is the pre-diabetes. What symptoms are seen and felt during this period?
During that period, a lot of times, and these symptoms, like I always tell patients, they're going to fluctuate, okay? They can all of a sudden start having frequent urination, even at night, have to get up 3 or 4 times during the night. Then it could stop. And I'll always say, if you notice that, does it happen after you've eaten a high carbohydrate diet? Or maybe you went into a fiesta and you ate a lot of tamales and you ate a lot of enchiladas and all these things, then they say, yeah, and I started noticing that I couldn't focus my eyesight, because it affects the eyes also, Then they say, yeah, I would feel numbing and tingling to my feet, like they were getting numb. And then I'll say, yeah, well, that's probably signs of diabetes. Or they'll say, I started losing weight, Mr. Jasso, and I'm not really trying, but I'm losing it. But I don't really feel that good. So that's another sign, sudden weight loss, Others will say, well, I get real thirsty and my skin gets real dry. And I barely drank water, and, well, because they're peeing so much, they're getting dehydrated, so they have that. And then another thing, some women will get vaginal yeast infections. Of course, it starts affecting men sexually also, all those kind of things. So they can come and go, and during that time, they keep going like this, because I say, your sugars go up and down, depending on what you're eating. And then stress plays a big part on this. If they're dehydrated, working out there in the fields, they're not keeping themselves hydrated, it could stress their body and their sugars go up. And so there's all those signs and symptoms. Also, they start having like pain in the legs. Some of them have cramps in the early morning. They'll say, yeah, I started getting some leg cramps, at night, like around 3 or 4 o'clock in the morning, and they were so intense. I say, well, you might want to check your sugars at that time. If you have to get up there in the night quite a bit, check your sugar and see where it's at that time. But those are signs. If they don't have a meter, I say start watching those signs of diabetes.
How difficult is it to have access to diabetes checkups, in our community? Is it so difficult that people don't have an opportunity to check it and then realize that it's too late and they have diabetes?
You know what? Actually, like a lot of times, if they've read about diabetes, we try and educate them that they need to talk to the physician if they see that they're having symptoms of diabetes. Again, right now, with Southern New Mexico, we do have that program now that we've been working with, and they've always had it in place, going to those health fairs and getting the blood check. That's a good opportunity for them to go. They have them throughout the community. There's also, some of the clinics have health fairs, and usually there's always somebody there doing blood checks. And that would be good for them to go. That would be a start. And so they have identify high blood sugar at that health fair. That would prompt them then to go to a doctor and see if it was just a one-time thing, or maybe there is a reason why they need to be going out to a doctor to monitor their blood sugars.
And how difficult are the tests? I mean, is this something that, do they have to fast? Do they have to do something specific?
You know what? Okay, if they're going to have lab work, they have to be fasting in order to get a fasting blood sugar in the morning. But if they're going to a health fair, they should be asking them before they check blood sugar, when was the last time you ate? And if they say, and let's say it's 10 o'clock, and they say, well, I ate around 8 o'clock in the morning, that'd be a perfect time to check their sugar, because that's 2 hours from the time that they started eating. So then they'll look at their blood sugars, and let's say it's over 200. Wow, it should not be over 200. It should be less than that. Some literature say less than 120, others say less than 140, others say less than 160, less than 180. But anything over 200, then, there's already a problem there.
So in a lot of ways, what you're saying and what I'm hearing is there is no excuse to get your diabetes checked. Regardless of what your culture is, because they're readily available through your doctor, through health fairs, and it takes a matter of moments.
Mm-hmm. You know what it is? A lot of times patients are the needle getting poked. A lot of them say, oh, it's going to hurt. It's going to hurt. And we have to reassure them, you know what? You might feel it and you might not. If you do, it's just going to be a little thick. But a lot of us there say, I don't want to get poked. I don't want to get poked. They're a needle phobia, and they just don't want to go through that, And so a lot of times when we would go see patients and we're teaching them how to start using their little poker, they say, I can't poke myself. It's going to hurt. I don't want to poke myself.
The anticipation.
Right, the anticipation. They start sweating and all this because they get so nervous because now they have to poke themselves. So a lot of them it's avoidance because they don't want to feel pain. They don't want to hurt. And so a lot of times we tell them, you know what? Now the new glucometers and the strips require very little blood. Set your setting like either at a 1 or a 1 point dot, it's a dot, and you'll see that just a little poke, and then just wait, and then you squeeze it and you'll see your blood come out. Because the strips nowadays, they require very little blood. Not like years ago, they required a big dot of blood. And so a lot of patients, oh wow, it really hurts and squeezing my fingers to get blood out. But usually a lot of times it's that they don't want to get poked. They hate that idea of getting poked.
Do you talk to them about how this one little poke has some serious prevention for their diabetes, that it could be worse if they don't get it checked?
Right. And we tell them that, because then, if you don't check your sugar, how are you going to know if how you're taking care of yourself? How well are you doing with your medications or your diet? Those kind of things. That little blood is going to give us a little history of how they're doing with their medication, their treatment, their diet. And of course, it's going to avoid foot problems, eye problems, kidney problems, all the complications of diabetes.
Let's talk about some of these complications, because when I read the list, I thought, before I read it, that complications were about 5 or 6 of these complications. And there's well over 15 complications on this list, including eye complications. What happens to the eyes during the process of diabetes?
Well, remember, like I said earlier, this is a vascular disease. And so from head to toe, we have all these big arteries, vessels, and all this. So the eye requires a big vessel in there. So remember that when your blood sugars are high, it causes blockage. It also causes high cholesterol, and it can also put pressure on your eye and rupture your eye in the back. That's a diabetics, or everybody should be having at least a yearly checkup with their eyes to see, again, because hypertension is another thing that comes associated with diabetes also. So yes, it does affect the eyes. It puts pressure in the eyes. They're at risk for developing glaucoma, developing cataracts, so retinopathy. So, they start losing their peripheral vision also. So yes, it affects the eyes. Another thing is now they're really stressing that get their dental checkup. Dentists be aware of the gum disease is another sign of diabetes. You see a lot of that dental caries and dental infections, gum infections. Maybe this patient needs to go see a physician or get their blood sugar checked because they start losing their teeth. Just recently, I've received some information on also hearing loss. There's now a
See,
study.
again, this is something that I have followed the disease because it's in my family, and never would have thought about hearing loss.
Right. Yeah, and now there was a study that just came out recently that it affects the inner ear, and so there's a hearing loss is something that they should start also looking at hearing loss, And of course, vascular, it affects the feet, the extremities, at risk for heart attacks, at risk for strokes. Because like I always tell patients, just picture your blood should actually, if you were to put a pearl in this water, it would float down. But if your sugar's real high, it looks like syrup, put the pearl, it's not gonna move. It'll move, but very slow. So there's a risk then for developing plaque and developing a stroke also,
There's the complication of dealing with feet. That again, that's one of the complications I was familiar with. And what happens to the feet, and what is the role of how diabetes affects the feet?
Okay, remember that the heart puts out the blood out into extremities. So when it gets to the feet, there's a little valve to move the blood back up, so it doesn't move it as fast. Because remember, it needs to come back to the heart. And so it's caused stagnation, and lack of oxygen to the extremities. So then it starts doing damage. The feet start getting real dry. They get fungal nail. And then, of course, then there's a risk for infection to fall, especially if they get a cut or a little wound. And then, of course, another sign, they start getting swelling, in their feet. Then that's the kind with diabetics. We always recommend that they go see a podiatrist. Frequently, they're having feet problems. Also see a dentist and eye doctor, at least every 6 months. But if they're having problems, of course, it's going to require for them to go more frequent to see this specialist.
What is the future of diabetes?
The future of diabetes, there's a lot of research being done with diabetes. There's a lot of medications out there now for diabetes. Like they say, if you were going to be a diabetic, because my grandfather was a diabetic, and I remember as a little boy, he had to boil his needles, and the insulin was beef, and he had glass syringes and all this. And now the technology now, he had to urinate in a little cup and dip a little strip in there, and depending what color it turned, determined whether it was a 4+, 3+. He had to give himself his insulin according to those 3+ or 2+, And now the technology, in 1986, they came out with a glucometer now, where the patients can buy their own glucometer, monitor their own sugars at home, not have to wait 2 hours to go see the doctor. They can do it in their own home. The technology now with those meters they used to be big like this. Now they're about that big. The poker to poke themselves now requires very little blood. There's a lot of medications now that are coming out there for diabetics. So there's a big research being done. And the technology is really that's moving all of this in a better direction. So a lot of times, I look back and I say, if I was to be a diabetic, I would want to be now, not years ago.
And, but it all starts with getting checked up
Right. Exactly.
and, getting information.
Right, and also knowing the signs and symptoms of diabetes. But see, a lot of times patients know or have heard about the symptoms, but they're in denial. Because who wants to be told they have a chronic disease?
I would imagine nobody. No one.
No. And so when they're told you're a diabetic, it's almost like, I'm doomed now. This is it. I'm going to die soon. And no, it's not. You just, like I always tell them, you need to take control of this disease so it won't take control of your life. Because if you don't take control of it, it will control your life. And so that's where the education comes in teaching them what are the carbohydrates. The food portions, they'll tell me, well, Mr. Jasso, there's nothing, I can't eat anymore. No, I can't eat the tamales no more, I can't eat the beans.
Oh, I hear that all the time.
Yes.
Ya se me acabó todo.
Ya se me acabó todo, ya no puedo comer,
gone.
that's it.
Yeah.
Now, and I say, no. In moderation, Yes, you can have a taco. It has meat, it's a protein. The protein is not going to affect you. It has lettuce, tomato, and all that. So, but you know what? We want to eat a dozen tacos instead of,
Because that's what we grew up with.
That's what we do out
we
there.
like.
Exactly.
Well, TJ, I want to thank you very much for being here on Fronteras, a Changing America, and keeping us informed as to what's happening in the community and diabetes.
Okay.
Thank you for joining us. I'm Edmundo Resendez for Fronteras, a Changing America.